Get away from a screen.
Get in that fucking gym. That's what you need to
Get
do.
in the gym, get away from a screen. It's
Whatever you're
amazing when
fucking angry about, just push that fucking weight.
turn your phone off for a week.
Yep.
Literally. Turn it
Yeah.
off. Don't get on any social
I mean,
media.
in all honesty, that's what I should have wrote that dude. Like,
Yeah.
listen, you know what you should do? You shouldn't
Not
even be on fucking TikTok or any
no.
social media. Throw your
Get
fucking phone in the river.
yeah, it's not going to do you any favors. It's going to
Yeah.
make it worse.
Yep. 100% agree. Well, so Josh, when it comes to TRT, it would be nice. I know everyone would love to have their insurance pay for
Ooh,
their TRT,
yes.
but that may not be a great option.
No. This is a good topic. I'm glad we decided to talk about this today
Hmm.
because it comes up a lot. Um, and I think you're paying for insurance. Most people are paying for insurance, right? And they want to be able to use it. They want to be able to use those dollars that they're paying into. Um, but I think you have to understand where the insurance side of things comes from, and that's what a lot of people don't understand, at least on the health side of insurance. And it's kind of like this for all insurance. Actually, I just had a lady pop in. She runs an auto uh, body shop.
Mm.
Okay. And so they deal a lot with insurance. So we were kind of talking about stuff like this today, and we'll kind of get into these themes as we go. But she faces the same challenges that people face with health insurance, just kind of on the auto side.
Yeah. It's
So,
funny you
and,
say that because my dad worked in a body shop for 40 years
uh,
and I worked in a body shop for 4 years. And in the very beginning, I worked in a body shop and I would deal with insurance companies and we worked in a high end area, very, very high, right near Villanova University,
okay.
literally
Yeah.
right down the street. So Villanova. And people would have 1 year old, like 7 Series Beamers, and
Hmm.
like someone would hit their door. So our company would write for a new door, and the insurance company would say, we'll get a used door. So how you would handle that is that the manager would call the homeowner or the car owner, I should say,
Car owner. Yeah.
and say, your insurance company wants to put a used door on your car. And then 20 minutes later, you would get a call back to put a new door on because they would freak out,
See,
freak out.
the
So,
problem is nowadays, I feel like that just doesn't happen anymore. Like you can call and complain, and they're like, "Too bad we don't care,"
right, yes.
and that's basically what it is. So, um, but yeah, why doesn't insurance cover TRT? Why doesn't it cover a lot of services? Because the purpose of insurance is to deny as many things as possible.
Mm,
That's literally
sure.
the point of it. Okay. Um, why doesn't it cover your TRT? TRT is not deemed as essential. Okay. Even though we have data out there and we can show that it improves, your body composition, which will directly improve
Right.
your or decrease the risk for mortality, morbidity, less visceral fat, better VO2 max. We know these things already.
Hmm.
But insurance doesn't care because they're just not going to cover it unless you're below a threshold deemed by that insurance, not by the lab, by the insurance, mind you. Okay. The lab can have their own values. The
Hmm.
insurance sets the terms. Okay. So it may be 250 or whatever.
Yeah, I was going to say, is there scale like similar? Or do you know? I guess we
It's
don't know.
close to it. I think
Oh.
that, most of it's like 250 and they're going to say it needs to be under that, but it depends on the lab reference used too, right? Like
Mm.
they may have the case in point here. And I always tell you this is so whenever I would order a test, okay, as a clinician when I worked in urology, and I'll give you a great reference here. So 3T MRI of the prostate, okay, 3 Tesla MRI. It's used to look at the prostate to determine if there is a lesion in the prostate, whether or not we should get a biopsy or not. Okay, sort of a precursor to a biopsy, and the reason it existed was so you didn't have to get a biopsy blind. It was for somebody that maybe had a normal DRE,
Oh,
digital rectal
okay.
exam, couldn't feel any disease, but their PSA kept going up, right?
Right.
So your options at that point are to A, continue to observe, or B, get a biopsy. And, leading up into that point, this is where all that controversy came with the PSA that I know we've talked about before, is that it was leading to an overabundance of biopsies. So a lot of people were having biopsy that probably didn't need it.
Mm.
So MRI, this 3 Tesla magnet MRI comes in and is like groundbreaking. Like it's really awesome. It does a good job at really kind of picking out lesions and whether or not you should or shouldn't go do a biopsy. You can even take it a step further and have what's called a fusion biopsy, which then takes that MRI image and fuses it with an ultrasound. So when they go to do the biopsy, it makes like a 3D model of your
Oh, no
prostate
shit.
and it shows the lesion, like where it's at. And they can spin the model around with the probe and they like triangulate it and just get that exact spot. It's freaking slick. And then like they
Yeah.
can shoot it and then like swing it and it'll turn the model to the side and you can see like every angle that it went on like
No
a
shit.
three-dimensional. Yeah, because I mean, if you see a 2D and it goes like this, but if you turn
Right.
it to the
Can't see.
side,
Right.
it's in
Just
front of it,
up.
not in
Right.
there. You know
Right.
what I mean?
Right.
So you can do all angles with that shit. So it's a really great tool to determine. Okay. And you need to get it done before a biopsy. That's the whole reason you're getting it.
Mm-hmm.
I would order these, and the insurance would argue with me that the patient needed to have a biopsy before they got the MRI.
Jesus Christ.
Because somewhere along the line, a guideline was written that said you have to have a negative biopsy, then have an MRI after it's negative if PSA continues to go up, and then you could have
Mm-hmm.
but
Right.
now this patient's likely going to have 2 biopsies.
Right.
So why not just do one test, measure
And
twice,
then
cut once,
correct.
right? But people don't think like that. So that's the point of insurance. I would argue with them. And then I would say, well, hey, AUA guidelines say this. And then they would go, well, okay, AUA guidelines may say that, but we don't use AUA guidelines. We use, United States Preventive Service Task Force guidelines.
Jesus.
And they say don't do it. So because that says that that doesn't do it. And this is literally, I can't prove this, but this is literally what I think they do. Whatever guideline that came out that says don't do it is who they followed. So if it was for like prostate biopsy and there was a guideline somewhere that said don't do it, that's what they followed. Now, if it
Right.
was something else like a kidney biopsy, even though it's in the same like GU family and it was like a completely different place, maybe that same parent body, that same guideline governing body was like, don't do prostate biopsies if this condition, but do kidney biopsies in this specific condition.
Uh-huh.
They wouldn't use that one then for the kidney. They would get a different one pulled in and be like, nope, this one for the kidney says
Right.
no.
Right.
So
Yeah.
they would just take every single one that
Anything that's
says no,
right.
no, 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 just so they
Jesus.
couldn't fucking pay for it.
Yeah. Fucking
Okay.
evil pricks.
So you have to understand that's literally the purpose of an insurance company is to pretty much deny everything that they can.
Mm-hmm.
Okay. Even stupid shit. I know I've talked about trying to order CAT scans for people with uric acid stone histories. And they'd be like, get an x-ray. I'm like, they don't show up on an x-ray. That's why I ordered a fucking CAT scan. like, like who like, and I have to tell you this, like you're
Right.
supposed to have people on staff that know this,
Yeah.
but they don't. I mean, it's a soulless job.
Jesus
Okay.
Christ.
So that is the purpose of insurance, okay, is to deny anything. They never want to pay for shit. So I think the sooner people realize that they never want to pay for anything, the sooner they realize that it's just not going to pay for anything.
Right.
Okay. Second, out of that comes there's 3 parts of this. 1, insurance doesn't want to pay for it. 2, does your doctor even know what they're doing? So say it's low and he's like, well, I can order it for you. Okay, then what?
Right.
I mean, I have a guy coming to me this week that's on 80 milligrams, 1 shot every 2 weeks.
What?
Yeah. Yeah. Because that's what his doctor does, because his doctor has no idea what he's doing. No offense, not throwing shade at doctors, but that's what I'm getting at. There's not a lot of education there. And they don't know. So they're just kind of doing to do. And remember, they're just trying to get you in these reference ranges. Like,
Does
to
this
get you
dude feel
between,
like terrible, or is
yeah,
he?
that's why he's coming to me.
Yeah. Okay.
Because he
I was
feels
gonna say.
awful. And we just checked his labs and his total testosterone is 177. Okay. With
His
a fully
to-
his total
total
is
is
177. Yeah, because he's completely, so people don't realize this. You give that shot, right? It goes up for, if I give you 80 milligrams, your
Spikes,
T
yeah.
is going to go up
Right.
for a period of time.
Right.
But then as that ester's half-life wears off,
Mhm.
and you're going to go below where you started.
Right.
Because
And
what's
it's
going to
one every
happen
2
is,
weeks.
He's on it every 2 weeks,
Oh
right?
my God.
Which is what medicine does. Let's say, okay, maybe he gives him 80 milligrams every week. Okay,
Right.
let's just say he's going to do that. All right,
Mm-hmm.
still not great. It's
Yeah,
better than every 2 weeks, but
correct.
and I believe this guy. Yeah, I think he gets it every week now. That I have to look at the chart. I'm
Mm,
pretty sure it's 80 milligrams every week, and his
okay.
his test came back at 177
Holy
on a trough.
shit.
So that means that, like, let's say you started at 300, or let's say you started at 250.
Yeah.
Now you're at 177. What did we replace?
Yeah. You
Like,
you're going the wrong way, homie.
right. So I mean, this guy, and people don't realize this, that, like, if you don't give enough consistently, you will castrate yourself and end up worse than where you're at. That's what
Yeah.
androgel does most times. That's why I don't like it, because
Ah.
it'll turn off your brain from
Mm-hmm.
producing whatever you produce, even though it sucks, it's not great. And it'll shut off your brain, but not replace more than what your body was giving you to begin with over a period of time. And you end up lower than where you were. You're essentially castrating yourself.
Yeah. So
Okay.
Josh, what was this guy's, do you know his test numbers before he started this?
I don't. I can
Don't.
find that out. I didn't do the consult yet. I just got,
Mm.
like, the lab that we just did on this person,
Oh,
and that's
okay.
what
So
it
you just
was.
have that.
So I haven't done the
How long
consult yet.
has he been doing it for?
That I don't know either.
This
So I
poor
wish
bastard.
I know, but this story is not unique. I mean,
No,
this
no,
is
it's
a
true.
very common story.
Yeah, you're
Okay,
right.
so one, insurance doesn't want to pay for anything. Two, you have a provider that has no idea, or thinks that you're gonna do steroids and you're gonna get big like Jay Cutler, blah blah blah, or you're gonna have a heart attack, or you're gonna have a
Yeah.
stroke, or you're gonna get prostate cancer, or this,
Yep.
that, and the other. Any other bullshit that's completely false.
Mm-hmm.
They're just no fucking clue, ignorant to the gills, not willing to learn. That's the part I hate. Right?
Yeah.
If you're a clinician, if you're a physician, nurse practitioner, PA, whatever, to function at your best capacity, you must accept criticisms. One,
Mm-hmm.
okay. You must be willing to learn more than what you know. Two, okay. And three, you must be humble about it the whole time. Right. That's
That's
what
actually
makes,
pretty good advice for adults, all
yeah,
adults
all
walking on
adults.
the earth.
Right. But but you have to be, like, if you go into it with this mentality, then prove it. You
Right.
can't, because it doesn't exist. It's bullshit.
Mm-hmm.
It's a stigma. It's a fallacy you're following, running on, that is complete and utter bullshit.
Mm-hmm.
Okay. So we have that. So insurance doesn't pay, provider doesn't know what they're doing. Three is the clinic component. And this is what I think people also miss out on. So say you have insurance is paying. Okay. Say you have a doctor that'll order it for you. And now you have the lab portion. Well, insurance is more than likely need a prior authorization to get that done. And who does that prior authorization? Somebody in the clinic has to do it.
Right.
Okay. And that takes up a lot of time. All right. And so they're going to get that prior authorization, and they're going to have to send it in. And if anything changes with your insurance, they may have to send another prior authorization in to get that done. They may change the terms. They may say it's not 250. I've had guys, and I'm not even kidding you, go on testosterone, okay, where they've seen a lab and their lab's 240. And they're like, okay, we'll get testosterone. They give them testosterone. And then their lab, they check it down the road 3 months later, and it comes back and it's 700. Not anything crazy.
Mm-hmm.
And they go, well, your testosterone's over 700. We're not going to pay for testosterone anymore, even though it's the testosterone that they prescribed that got them
What?
there. Yes. That's
What
how
the
fucking
fuck?
retarded it is.
Yeah, how does that make any fucking sense?
They don't want to pay for anything. That's what I'm saying. They're going to find any way they can to not pay for your care, period.
Holy
Okay.
shit.
So that brings us to the question. So you have the time component. And then two, resources at a clinic is going to be set forth by the health organization that's there. It's either going to be a private practice, which are dwindling,
Yeah.
right? Because
Mhm.
it's the regulations behind it anymore, or it's really hard to run a private practice that's not cash based. You cannot run a private practice off insurance. It is the reimbursement rates are terrible for the amount of overhead and investment you need to have. That's
Yeah.
why almost none of them exist anymore. The only private practices you'll see is like large orthopedic groups. Okay. They have some large urology groups. They call them LUGPAs, large urology group physician associations, LUGPAs. Okay. Um, and it'll have like 100 urologists in it, but
Mm.
they usually own a surgery center. Like they're like the Rockefeller. They Rockefeller that they own
Oh,
every component
yeah,
along the
right.
way,
Yeah,
right? They
that
own
makes
the
sense.
lab, they own
Mhm.
the everything, and all the money stays in house, right?
Mm.
Because at the end of the day, this is a business, right?
Yeah,
Um, so you have this time component where now this office has to spend extra resources on getting something done in the midst of maybe getting this person's critical CT scan prior auth, right? Is your testosterone going to come before that person's CT scan? Probably not, right? Because
right.
that CT scan is diagnostic and they need that to determine what's going on with this person. Whereas your testosterone is just not that important. So it just kind of falls on the wayside. So we would see sometimes in the clinic is people would complain like, when's my testosterone coming and blah, 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 blah. And when can you send this prescription out? I'm like, we've sent it to the insurance company or we'll get to it. You know what I mean? And it's just,
Just
it's a
waiting.
time thing. And then these
Huh.
people get like kind of angry, which I can understand. But
Yeah,
at the
no,
same
I get
time,
it.
this is you using your insurance. What happens when you pay cash? Yo, Josh, my test is low. Okay, done.
Yeah,
2 seconds.
right, right.
Was there any wait? Was there any prior auth? Was there any issue with the physician not knowing what they're doing? Was there any issues with the lab? Oh, we're out of range. Nope, I want you out of range.
Hmm.
Like,
Yeah, exactly.
was there any issues with that? No. Why? Because you're going to a clinic with someone knows what they're doing. They're pragmatic. They're willing to learn. They're willing to change and hear other viewpoints. They're very on top of their game. They're
Yeah,
focusing on you, right? No insurance is involved, so there's no denial. You're paying for it,
yeah,
right?
exactly. You're getting what you pay
And
for.
exactly. And I think that's the people are finally coming around to realizing that insurance is a giant scam. I mean, we all kind of knew it was a giant scam,
Yeah,
but I
right.
think it's becoming more evident how
Yeah,
scammy it actually is.
yeah.
And I'm
It's
going to highlight
gross.
on that. I'm going to highlight on that too. So I don't know if you saw this in the news or not, but two major healthcare organizations, Cigna and Aetna, are now going to be downcoding visits for patients.
What's
And
down coding mean?
okay, so in order to understand how let's just take me. I'm working in a health office for a company. Okay.
Hmm.
Because like I said, there's like no private practices anymore. I work for a regional health organization, whatever it may be in your area, right?
Right.
You could work for Kaiser Permanente, they're a large one, or you could work for Valley Health, or you could work for Lehigh Valley, or you could work for, there's a bunch of regional health systems, UPMC or whomever, right?
Hmm.
They're all over the place. They all work the same though. All right. So I work for there. And in order for me to see a patient, I would have to bill a level of service for said patient. And these levels of service is going to range between 1 and 5. Okay. New patients are separate, returning patients, same thing, just the reimbursement rates change a little bit. New patients are worth more money than returning patients.
Oh,
Okay.
really?
Yeah. Yeah. Slightly more than a returning patient. That's because you're establishing care. That's why it's more money.
Oh,
Okay.
okay. Yeah, that
Yeah.
makes sense.
Yeah. So you get assigned a level of service. That level of service takes in multiple things. How much charting did I have to review before you came? How much lab work did I have to look at? How many issues am I like looking at? How
Hmm.
much diagnostics do I, how much lab work, imaging, whatever, do I need a medication to manage the problem? Right. That all factors in, we call that
Yeah.
medical decision making into what level of service you get. Almost everybody falls into like a level 3 and a level 4, pretty much verbatim. Okay. Very few people fall into a level 5. That's a lot of care. The other thing too is in terms of medical decision making, you could also bill by time. So I think a 20-minute plus is a level 3, 30-minute plus is a level 4 for like a returning patient. It's longer for like an established one. Don't quote me on these. It's been a while since I've done this.
Yeah.
And I had like a little wizard that would help me out too. So because it's impossible to remember all this stuff and what you're supposed to do all the time.
Sure, I can
Okay,
imagine.
so you'd have to put a level of service in, and that's how we got paid, and that's how the company would get paid, and subsequently how I would get paid too. Okay, and
Hmm.
they would track my metrics, like how productive am I, right? How many codes am I putting in appropriately on patients, because we would get audited on those too.
Mm.
Okay, and each level of service comes with what's called a RVU. Okay, and this is insurance speak here, so I'm going to be, um, An RVU stands for relative value unit. And RVUs are attached to levels of service. They're attached to CPT codes, which are like procedural codes, right? Like if you came in to see me and I had to do a scrotal incision and drainage, like because you had an abscess or something, which I have
Hmm.
done, that has a CPT code associated with it. And then that gets billed for a certain amount of RVUs.
Mm.
Okay. If you have surgery, surgery has its own RVU values attached to that specific surgery. Okay.
Okay.
RVUs are what determine how much that procedure is getting paid because the contract written between the insurance company and the entity, in this case, the health entity, is contractual and they pay a base RVU rate based on what they contract.
Okay. So is that like a negotiated rate or is it just like this is
Correct.
what? Okay.
Correct. For private insurers, it is negotiated. For
Mm.
Medicare, there is no negotiation. You get what Medicare pays. And for
Right.
Medicare for 2025 per RVU, I believe it's $32.34 per RVU
Okay.
associated. So Medicare, I think we were talking about this earlier. A level 3 established patient visit is 2.68 total RVUs. Okay.
Hmm.
Those RVUs then can be split further into like work RVUs and practice RVUs and malpractice RVUs. But that's organizational level. That's not like
Yeah.
insurance level. Insurance
Right.
is just looking at the total. Here you go. How the company splits it is how they split it.
Right.
Okay. So I'm not going to get into that. We're just going to focus on TRVUs or total RVUs. Okay, so 2.68 for a level 3 returning patient. Medicare pays 32.34 per RVU. Okay, private insurers, because it's a negotiated rate, tend to pay more per RVU than what Medicare pays
Yeah.
because a lot of health entities, if they were to just see purely Medicare and Medicaid, would be operating at a loss,
Sure.
right? When I worked for my previous employer before they merged, we had a meeting on that. And basically, with at the time, this was probably 8 years ago. At the time, Medicare was reimbursing about 80% or 80 cents on the dollar that we spent, and
Mhm.
Medicaid was reimbursing about 60 cents on the dollar that we spent. Meaning, not everybody in your area has Medicare and Medicaid, right? You still have private insurance.
Right.
Okay. But the ratio of Medicare and Medicaid to private insurance is important on how you're going to structure a business because if you're operating at a loss and 60% of your payer mix is Medicare and Medicaid, then that 40% that's not has to make up the deficit and then some
Yeah.
in order
Right.
to make a
Profit.
profit. You know,
Right.
see what I mean? Because
Hmm.
if you're in the hole, the only way to get back out is to like get to the surface and then get
Yeah.
out, right? So you have to make more than what they're. So oftentimes private insurances would pay double that RVU rate or more,
So what about in areas that are like there's a lot of Medicare and Medicaid, like like a city or something, there's always going to
right?
be.
I think a lot of some of those get some federal and or state grants to continue for like
Oh, okay.
critical
So
access
there's
centers.
something.
So there's some different programs, but look at the level of service you'll get at a place like that versus somewhere that's not,
Yeah.
right?
Right.
It's not going to be good. Why? The money's not there,
Huh.
right? And if the money's not there, I mean, you get a lot of these like federally qualified healthcare service, FQHCs is what they're called, and they attract a lot. We actually have one in the town north of me, and it's because it's for like a rural population.
Hmm.
We actually have a lot of a Hispanic, Spanish speaking population in this area too.
Hmm.
So because of like migrant work, that's been historic because there's a lot of agricultural jobs around here. So it's not new, very historic to have them around here. Um, and they're hardworking people. Don't get me wrong. But they use that healthcare center because a lot of them don't speak English, right? And so they have people that can translate there at these quality centers. And
Right.
I will say the one we have does a pretty damn good job. Like they're pretty efficient, but they operate at a loss and they actually get like private donors to donate there to like help prop
Oh,
up that.
no
And then
shit.
they get state grant money and everything else. Because if they were just to purely operate on
Just
like
yeah.
Medicaid, essentially, they would go broke in 2 seconds. There's
Jesus
no
Christ.
way they'd be able to operate.
That's fucked up.
Yeah. So back to the RVU, right? So you get a total RVU value assigned to your visit. Okay. And like I said, most everybody's level 3. It's easy to get level 4. So I'll put this out there, right? If you're a doctors specifically, and maybe some other healthcare individuals, and this is why I left, because they didn't want to negotiate with me. I wanted an RVU based contract. What that means is if you're more productive, okay, and I'm bringing in more RVUs, I want to get paid per RVU, not
Right.
like a stagnant. I want to like, and I was well ahead of my peers, 30% higher than the next person in terms of RVU generation. I was very efficient
Yeah.
because I was good. I
Yeah.
invested a lot of eggs. I took pride in my work, and it showed. Um, but when I went to my place and said, "Hey, can we organize a contract?" Because and I tracked all my RVUs. I'm like, "Here's where I am, and here's where the next
Yeah.
person is." At least that I could gather from that because they had all the internal data. They were like, "Too bad we don't negotiate with nurse practitioners. You're not a physician. We don't care."
Oh, so do they do that with physicians?
Oh
Like
yeah,
can,
they'll do RVU contracts for physician, but they wouldn't do it for me.
uh,
So that's why I left because they didn't want
yeah.
to they didn't want to come to the table. They basically said, "Listen, I we don't care how productive you are. We'll just replace you with somebody cheaper."
Right.
So
Yeah.
that's what they did.
Hmm.
So think about that. The next time you go into your doctor's office, that's how your health entity thinks. That person that's there is probably of no
Yeah.
value to them, and then they'll just get somebody cheaper in the next
Correct.
time. Even though you probably really like that person and they really care, if the organization doesn't show them how much they care about that person will eventually leave.
Sure.
Okay. It's like the book Voice and Exit. If you haven't read it, read it. It's great. It
I mean,
definitely
it's
applies to
somebody's
this.
job. I mean, they don't have to put up with that shit. They can go get somewhere else. Someone that's going to pay them and respect them.
Right. And I have a graphic that I'll talk about here in a little bit. And this was a study. It wasn't even really a study. It was more of an analysis done of actual data. So it's not like there's a randomized control trial. This is just taking big data and putting it on
Hmm.
a spectrum here. And I'm going to talk about that in a second. But anyway, back to the RVU. I asked for an RVU contract and they were like, too bad. I said, okay, fine. And that's what literally led me down the path to starting my own clinic. Best decision I ever made.
Yep. That's it.
Okay. So, back to those visits, right? We know we're going to get reimbursed X amount per visit. Okay. Aetna and Cigna now are saying if you're coded as a level 4, all right, we're going to a level 4, level 5, we're going to automatically down code to the next lowest code.
Damn, that's fucked up.
So if you're level 4, now you're level 3. And
So hold on, Josh. So if you are, is there a way to like, oh, I guess you can't. You can't. I was going to say make everything a level 5 because then you'd have to
no,
prove
right.
you'd have to
Because
have
then,
the
that,
medication
right.
and all
And
that.
then because if you bill
Uh,
erroneously like that, that's
right.
called fraud. And then next
Well,
thing you
it's
know, they're going
exactly
to,
what it is.
right. So then they're going to come after you for,
Yeah.
trying to defraud. Like when you see these like Medicare fraud claims and stuff
Hmm.
like that,
Basically what
that's
they're doing.
part of it, right? I mean,
Yeah.
there's some other ones, but it's usually submitting erroneous claims for services provided in order to get more money out of a service that wasn't provided.
Yeah.
Okay. But now
So,
private insurers are kind of catching on. And I think Aetna announced it first, and now Cigna's doing it. So it's just a matter of time probably before
yep. The
everybody starts
dominoes will
doing it.
fall.
So what does that mean? Okay. If doctors are primarily on potentially some type of RVU based contract, meaning how it usually works for them, and I know this because I have several friends that are physicians, um, is that they have an RVU minimum to meet their contract. Okay. So like if they're like, you need 8,000 RVUs a year for us to just pay you this rate. That means
Right.
they have to hit that 8,000 to get that rate. Or if they don't, they get a pay cut the next year.
Oh,
Okay.
no shit.
Oh yeah. Oh yeah, for sure. Right. So if you want paid more, you got to do more. All right.
Right.
But then they'll say like, okay, if you hit that 8,000 threshold and you go above it, then we'll give you X amount per RVU after that. Okay. To kind of incentivize them to see more. Okay.
Uh-huh.
And you get paid more to have level 4 visits than you do level 3 visits. So obviously, and it's pretty easy to get a level 4. If you remove that from the doctors and
Right.
automatically downcode them, one, it's going to be harder because remember, a level 4 total RVU is what, 3 point, I think it was like 3.7. I can't remember. Oh, here. 3.79 RVUs to 2.68 RVUs. If you cut out almost a whole RVU, overall like 1.1 RVU difference on, and that physician's counting on that being there to
Yeah.
their total for just base compensation, what do
Right.
you think is going to happen to your level of care over time?
Correct.
It's going to drop because people are going to be like, what the fuck am I doing this for?
Hmm.
Like, why did I go just to be a puppet for the insurance companies? Like, if they just want me to come in and I'll just see 20 people a day and, or 10 people a day and
Hmm.
yeah, whatever. And you can pay me
You have to
$150,000 a
work
year or whatever.
harder to earn the same amount of money.
Right.
Yeah.
Right. And
That's
and I'll
fucked
be
up.
like, I have a high level of respect for my physician colleagues because they went through a lot to get to that point. I mean, what more than I did for sure.
Yeah.
You know, you go through 12 years of your life base just before you come out and start earning real money.
Hmm.
Um, so I think they deserve, you know, the compensation that they're getting. But what does that mean? What does that eventually look like? What's it going to translate into you as a consumer of this product? Is that one, if you have these insurances, chances are your health entity could just drop that insurance period. And now you'll have an out of network charge for that health entity. You know, the same family doctor you've been going to for years is now out of network because the whole
Yeah.
parent company said, we ain't taking this insurance anymore. And now you got to pay more out of your pocket to get the same level of care that you used to get 5 years ago.
Jesus Christ.
Okay. That's one thing that's likely going to happen. Number two, okay, is that um, people are just going to stop caring as much, right? You know, like we all kind of got into this to help each other. Like I didn't do it because I wanted to be like flying a plane or whatever. Like that's not, this isn't the field you get in to do that.
No, no.
You know what I mean? Like have all that extra stuff. Those days are long gone,
Yeah.
long
Right.
gone. So, you know, it's is it well paid relative to some other things? Sure, but it's
Yeah.
incredibly high stress
Yeah.
job. One of the highest. I'm not saying it's the highest. There's some out there, but healthcare, like direct patient care healthcare worker, oh yeah, it's up
Yeah.
there for sure.
100%.
Um, and COVID proved that a million times over.
Hmm.
um, but that's what's going to happen. And I saw it years before I even left how much healthcare is changing, and it's getting to the point where it's getting very shaky and on very shaky ground to the point where I don't know what's going to happen in the next 5 years.
With
If
insurance, like in
with
total, you mean?
insurance and how care is delivered in this country, I don't
Huh.
know. We are in uncharted territory. The
Hmm.
problem is the only way to fix it is to tear it all down.
Right.
Like fix it properly.
Yeah.
Is you have to dismantle it all and
Yeah.
restart fresh. Because as of right now, all it's doing is we just keep slapping another coat of paint on the wall.
Sure.
You know, that's it. But then
That's
we still have all the other previous coats of
it's
paint underneath.
unfortunate, but that is a lot of our government is the same. Our insurance,
Yeah.
there's a lot of it's just it's so fucking rotten that the only way to fix it is to
We don't get
demolish it.
rid of the previous rule. We keep it and then add another one on top of it.
Correct.
You know what I
Correct.
mean? And I think what people are finally starting to realize is that what you can get when you actually pay for your health care is
Mhm.
everything you want out of it
Right.
versus everything you're not gaining out of it. I
Yeah.
don't have one person in my clinic that's unhappy with the money they spend at my clinic.
Hmm.
They're incredibly pleased with it because they get the results out of it. They get the response. They get, you know, the
Yeah.
like there's not I'm calling in and I didn't hear it from anybody for 2 weeks or this, that, and the other. They call into my office, they are answered that day.
Yeah.
Like usually within 5 to 10 minutes,
Right. Right.
if not immediately,
Something. Yeah.
if somebody's
Exactly.
available.
Hmm.
Because that's how I have it structured because I worked in that and I know what it's like. And I didn't want that for my patients because it doesn't work. It
Yeah.
sucks. You
Right.
know, that's literally why people leave.
Exactly.
So why would I do the same thing? And the other thing here is they're like, why don't you take insurance? Because in order to make the same amount of money for me to keep it, I would fall back into the same model I just left,
Right.
which is quantity versus quality. When you flip it, it costs more, but you get more,
Yeah. I
right?
can imagine that insurance would be a big pain in the balls when
Oh,
it comes to
and you don't
this.
even know if you're going to get the money back.
Right.
Medicare, if you take Medicare, they can take the money back from you. They could
Yeah.
pay you and next month go, whoop, nope, see ya.
Right.
We're going to relinquish this money. You don't even know if you're getting paid. And I've seen
Yeah,
so
that's
many
fucked up.
like smaller offices close
Well, of course.
because
That's
the pay structures are just chaotic and
yeah,
and
unpredictable.
erratic, right?
Yeah.
So my advice is this: if you're considering, like looking for paying for cash, or if you have an insurance product, do a couple things. One, find a plan that has the lowest premium you can pay, because the more premium, unless you got a lot of health issues that you've had for a while, if you're fairly healthy, maybe only take one or two medications,
Yeah.
lowest premium you absolutely can.
100%.
Get the highest deductible you can. Make sure you have have money sitting in an account that can cover the deductible, because the only thing that insurance should cover is like a catastrophic health bill for like 100 grand.
Yeah.
That's it. That's
Right.
literally, that should be the only thing it covers. Everything else, if you pay out of pocket for it, light years better.
Yeah.
Light
For
years
sure.
better.
For sure.
I mean, when I go to my dentist and I pay and I don't use insurance, they give me a cash discount. It ends up being cheaper for me to go to my dentist to pay cash than what it would be if I were to use my dental insurance.
No shit.
Yeah.
Well, I mean, I get it. I get where the dentist is coming
Because they
from
don't
too.
have to fight for the money. Because here's the thing, they
Right.
don't know if that insurance is even going to pay them.
Man, that's fucked up.
So they're like, they'd rather just take a little less, but take the payment, know they get it.
Yeah.
You know what
Yeah,
I
I
mean?
can
It works out well
imagine
for them.
you can imagine that an insurance company probably like if they were in like the testosterone would start to make stipulations on top of like not only just like 250, there would be other things that like
Oh
you
yeah.
can't
Oh
go
yeah.
above a certain
Oh sure. Like if it's too high, they'll cut you off. They'll
correct.
start making all these weird rules. Again, primary role of insurance is to find ways to not pay.
Correct.
Literally, that
Exactly.
is
It would just
MO number
start and
one
then
for
it would just
insurance.
keep snowballing into a
Yep.
fucking boy, what a fucking screwed up system that is.
It's awful. And it's why I left.
It's not healthcare. It's not healthcare at
It's
all.
not.
It's fucking sick care.
It's sick care. It is reactive, not proactive.
Right.
Right. I've gotten sick and I'm going to treat my symptoms, but not
Right.
address maybe the underlying cause. Maybe you got a good provider that sort of digs a little bit.
Yeah.
There's still a little bit of that
Yeah,
that's
because
out
if you
there.
think about like look at all the benefits. I mean, you see people that are on TRT. I mean, I see some people, but not as much as you do. And look at how much healthier they are overall.
Oh yeah. Oh yeah.
So,
And
I
that's,
mean, who
that's
wouldn't want a health? So, if you are a healthcare company, you would want to give people health care, which
right.
would, which would be
So
TRT
it's
or
funny,
whatever it may
like
be.
you bring that up. So like part of like the insurance, if you belong to like a larger health organization, they give you this, and then they would always have these stipulations like, we'll give you $50 off your premium if you go do all these steps. And they made it like ridiculous. You had to get like 3 blood panels a year. You had to be seen by a family doctor. Excuse me. You have to fill out this waiver. You had to say that you did this, and they would take like $50 off your premium because you were doing the healthy thing that they
Right.
deemed healthy. What they really were doing, as I never did it, because is they were trying to get more data on you to find out shit that they didn't want to pay for you.
Oh,
So,
no shit.
oh yeah, it's under the guise that, oh, I'm saving $50. They're like, yeah, we're gonna give you $50, but we're gonna deny $100 worth of care later on. Because,
Fucking pricks.
your liver enzyme was high because you went drinking that weekend.
Right.
Like that's how they
Hmm.
fucking do it.
Boy, that's evil, dude.
It is, dude. They are evil,
Hmm.
evil, and that's the other thing. A lot of these major healthcare companies are publicly traded.
Wow, that's the big problem.
Okay, so they are certainly beholden to their shareholders to make profit, and
Every
if they
quarter.
aren't, that's punishable by law. But
Mhm.
at what cost? Denying you the right to get a CT scan because you have a uric acid stone history, but they're going to order that X-ray. So
Right.
you get the X-ray and it doesn't show anything, and you still have pain. And then what do we have to do? We have to do the CT scan anyway. So
Right.
do we save any money, or do we increase the healthcare dollars spending?
Right. Exactly.
We increase the healthcare dollar spending because now you have 2 visits with me
Hmm.
and 2 images, and now your insurance has to pay for 2 visits with me and 2 tests when I just wanted 1 visit, 1 test.
Right. So it's just not efficient. That's all you know what I mean?
It's not designed to be. It's designed about maximum profit. They
Mhm.
don't give a shit about any efficiency at all.
Yeah.
It's all about how much they can say no. So,
Boy, that's fucked up.
but yeah, it all comes down to that. Deny everything. The training for physicians is not there. The knowledge base is not there. And
Yeah.
there are a lot that will acknowledge that. I mean, even the guy that you went to first off was a straight shooter and said, "Hey, Matt, I
Hmm.
don't know a lot about this. You're gonna have to go to a clinic." In my opinion, great doc. That's
Hmm.
perfect. That's the guy you want on your side because
Yeah.
he's acknowledging that he's like, listen, I don't have any bias against this, but this is out of my wheelhouse. You
Yeah.
need to go to somebody that this is their wheelhouse.
Yeah.
Beautiful. Love it. Couldn't say it any better because I would have done the same thing.
Hmm.
So you have that, and then you have the clinic hassle too. It's just it's just not worth it.
Yeah.
So, I'm getting a lot more people that are kind of understanding that, and they're kind of like waking up. Another thing is if you don't even want to have health insurance, like let's say you've got 10 grand in a savings account, you could ditch your insurance and get something like MediShare or like a faith-based one. It kind of
Yeah.
works like the Amish,
Yeah.
where you pay a monthly premium, but the premium's low.
Hmm.
You pay all of your healthcare stuff out of your own pocket. Okay. And you have a deductible, but then they cover the rest 100%.
Right.
So it's literally just catastrophic only, and you just spend your money how you want.
Yeah.
So if you have like right now, my wife and I are spending about $1,000 a month in insurance
Yeah.
between putting into our
Yep.
HSA and our insurance. It's about $1,000 a month. Okay.
Yeah.
About 60% of that's the premium, about 40% of that's the HSA, which is great. The HSA is nice because we can use that for whatever we want.
Hmm.
So that's another option you could have, or less to an extent FSA. They're more of a pain in the ass. But HSA you can pretty much use for anything. And that comes out pre-tax, which is nice. But you have to have an insurance product with that, meaning you're
Right.
still paying a premium.
Right.
Okay.
So, yeah. I mean,
I
you have to look at it this way. The cash versus insurance is at least the cash it's like freedom. You're able to choose and to say,
right.
yes, no, I do want to do, or I want to go somewhere else, or I
Yep.
want this, or I don't want that,
And
and then,
people are attentive. Like, for example, when was the last time you spent an hour at your doctor's office? You don't.
oh, probably the last
5 minutes.
3 times
But
combined wasn't even
with
an
the
hour.
actual, you'll spend an hour in the waiting room,
Yeah, for sure.
but you'll spend 5 minutes with the actual doctor getting your care done, or your provider, right? Maybe you get 10 minutes, 15 minutes. Maybe you've got a place that allows you to have 20 minutes to 30 minutes. I mean, wow,
Yeah.
that'd be amazing, right? But that's almost never the case. Okay. When you come to my clinic, you get an hour for your follow up. You get an hour and a half for your initial consult,
Right.
right?
Right.
Why do I do that? Because I want to be able to answer all your questions. You're paying for it. I'm going to give it to you. If
Yeah.
you don't want it, like if you want to cut it short on that's on you,
Sure. It's
right? That's
your
not on me,
decision.
right? It's your decision as a consumer to say, you know what? I'm good. I have all I need, and I'll go do something else. Thanks for
Yeah.
everything today. That's fine. But a lot of time we end up doing the whole hour because into bullshit about something,
Yeah.
and
That's got to
it's
be frustrating, especially if you are a doctor and you care about the patients, like, and you want to answer their questions, and you know what I mean, and
yep,
you're just like it's like a
you're
fucking
handcuffed.
assembly line, you know what I'm
Yep.
saying? Like, you're limited to 15 minutes, and like you see it's like 450, 451. You know what I mean?
Yep.
Like,
Well, you're
you know,
always behind. You're
yeah.
always behind. You can never get ahead. You're always operating behind because, what'll happen then too is like the organization that you typically work for, they'll try to cram more on your plate, right? You'll try to keep a managed plate for yourself, right? For me, that was around like 20 patients a day, which is a lot. Okay. It's a lot. I mean, I worked an 8-hour day with like a half-hour lunch break, but my lunch break was basically spent on the phone or charting.
Oh,
You know what I mean? Like
Jesus.
I was doing more work because I was getting caught up for my morning.
Mm,
And then whenever you're done, it was sort of like I got good towards the end. But when I first started, I never got out on time. I was always there about an hour late, and I didn't
yeah.
get paid for that.
Oh,
You
no
know,
shit.
no, it was your salary employee. So
Right.
you're
Right.
getting
Yeah.
based, your pay's on 2,080 hours, and every hour you work extra just lowers the amount you make.
Right.
So, no,
So,
I mean,
when you were saying earlier about the doctors, when they exceed, they get more. So then is the following year, is that their new threshold, or is it back
it
to,
depends. It depends on their contracts. There's a couple different ways, right? So if they have an RVU base to meet salary, if they exceed that, their salary doesn't go up. They just get bonus money quarterly
mm,
based on their contract RVU rate that they get per RVU over that threshold. Right.
yeah,
So, hey, I've hit 80,000 or 8,000. I've met my quota. I've made my base salary. Everything else is extra, but it's usually a diminishing return too. right? Like maybe up to 10,000, you get X
Correct.
dollar. And then from 10,000 to 12,000, it's a little less per that,
Right.
so like each time you go up, it's a little
It's
bit
like
more, a little bit
overtime.
less.
Like once you get to like 50 hours, just call
Correct.
it because
Yep.
then you're working for the government for,
Exactly. So there's like a sweet spot somewhere in there,
yeah.
that some people have figured out,
Yeah, 'cause
but
I would imagine that the hospital sees that and then says this is because they can get more. You know what I mean? Like this is the threshold, your
well,
new
they
threshold.
do. They
Right.
do
See,
because of the
fucking
health entities,
everybody's
like,
got their fucking hand out,
because
dude.
remember, they're getting paid when we talk
Right.
about that total RVU value, the organization's claiming part of it, and then
Correct.
the physician's getting the work RVU
Whatever.
associated.
Right.
So they
Exactly.
love for them to see a lot more people.
Exactly.
They love those 10-minute visits because they get paid.
Right.
And that
So
brings
you
me into
have a
the
for-profit insurance,
yep.
for-profit hospital,
Well, it
and a,
could be a non-for-profit hospital. They'll
well,
still do it the same way.
yeah. Well, they
But
all
there's
make fucking something. Yeah, but
oh yeah,
just because they
bullshit.
make $10 million and then you pay yourself $10 million doesn't mean it's fucking
Right.
not profitable.
Right.
It's like,
I want to
but
show you. Go
then,
ahead.
but it was
Finish.
saying that then the doctor and the patient, you know what I mean? Like that's where it comes down to. Both
Right.
this and the insurance is making money. The hospital's making money. I mean, the doctor's making money, but he's actually putting the time in, and the fucking patient is the one taking the beating.
Yep. That's
Yeah.
pretty much how it goes. And then two, the rising costs of healthcare. I know we've talked about this before. One of the things I like to bring up is a CT scan. I talk about that a lot. And I talk about that a lot because my dad was in radiology my whole life. He's not a radiologist. He was on more of like the practical side. He was an operations manager of a radiology department because he was an X-ray tech, then like progressed up and kind of got into management in the hospital. He was a corpsman in the Navy,
Oh.
independent duty corpsman, got out, became an X-ray tech, was an X-ray tech for many years when I was a kid, and then got into kind of like some hospital administration level, but more like geared towards radiology, that department.
Hmm.
And then eventually, my dad passed away unexpectedly in 2023, but at the age of 56. I have my theories on that. I'm not going to get into that. But at any rate, he just got promoted to senior VP like 2 weeks prior.
No shit.
Yeah, of cardiology and radiology, because cardiology does a lot of imaging. Um, so yeah, he used to have to go over when he was the director. If they needed a new CT scan or MRI, he would go, like, I think he went to Germany the one time. That's where Siemens is. Siemens is headquartered in Germany.
Yeah.
They make a lot of X-ray equipment. GE obviously makes it too. There's a couple big players. And they were just trying to see, like, okay, what scanner is going to serve us best? We need to get another one. And a CT scanner at the time, I think it was like 1.3 million is how much the CT scanner. But you got to understand, like, it's going to last a while, at least 10 years, right? 10 years out of a scanner. Maybe let's just say less. Let's say it's 8 years. Okay. So it costs 1.3 million. How much are you being billed for, let's say, a CT of your head? $3,000, right? And
Right.
how many CAT scans are they running a day out of one scanner? 30 plus,
Yeah.
and your cheapest CT scan is probably a $2,000 bill. You know what I mean? So
Yeah.
how much, and that doesn't mean they're going to get that back, but let's say they even get, 3/4 of it back. They get 1750, you know, so you're probably making, I don't know, $30,000 a day
Yeah. Right.
just out of
Exactly.
that
On
scanner.
that, just that one machine.
It's paid for in a month,
Mother of
and
God.
then everything else. And people wonder why healthcare costs are so expensive. It doesn't cost that much to get a CAT scan. It doesn't. It really
Mm.
doesn't. I mean, and when you look at your bill, a lot of places will itemize it. So there's a bill for like the scan itself, and then there's usually a radiology bill that comes separate for somebody to actually read the scan.
Oh, so it's not
So
just
there's two different
incorporated.
bills typically.
Right.
Okay. Anesthesia is the same way. You go to have surgery, you have a bill for surgery, and then you get another anesthesia bill on top of it because it was completely separate.
Yeah. So the
Okay.
person that's reading the scan, do they charge like a an hourly rate? Like, is it a time?
Usually, yeah, usually it's kind of based on time, but I find them to be at least reasonable. And like the whole cost, you might only have to pay like $125 for that,
Mm.
which, I think is fair. But
Yeah.
like the scan is just flat up ripping you off. You know what I mean? Like, it doesn't cost
So
that.
after
My
the first
wife,
month, you're just fucking profiting all that
oh, dude,
money.
My wife, she had to have an emergency appendectomy, not this past summer, the summer before, when we were on vacation in Delaware. Okay. She gets appendicitis. I take her to it wasn't the main hospital down there. It was like another one that was kind of, it was closer to where we were camping. And it was nice. It was new, but they didn't do surgery there. She has acute appendicitis. And they're like, we have to take you to emergency surgery. And I'm like, okay. So I drove her up there. Like, they allowed me to do that because I was a healthcare professional and worked in the hospital, and I knew what was going on, and literally worked in the recovery room. I was like, where do you want me to take her? We'll get this done. And they were great. They were fantastic. They did a really good job. We get the bill. Okay. And the mail, comes in. CT scan. It was like almost $6,000 for a CT of the abdomen and pelvis without contrast. I have ordered hundreds of those CAT scans. Never once was it $6,000. It was maybe 3,500, maybe $4,000. And I was like, call about that CT scan. I'm not paying $6,000 for a test that's like $3,500. No way. And she called and they're like, yeah, too bad. And they're like, you could have looked around to find a cheaper place to have it done. And you're like, how the fuck does
It's
that
an
work?
emergency.
Right. That's what I'm getting at. Like, yeah, let me just go call around. Hey, can I, what do you guys charge for a CT scan?
Yeah.
And let me just get over there right away and be able to do that. Fucking
What the
bullshit.
fuck, man?
Yeah.
That's what I'm saying. See, that's a soulless fucking job to do that.
Yeah. And so we ended up having to pay for that, which whatever. I mean, you're
Yeah,
not going to get
that's
out
just
of
what
it.
it is.
We
But
just paid that off actually. But yeah, I mean, there's that. So you have the cost of diagnostics. So one revenue generator is imaging and lab services. When I worked in urology, when I was getting ready to come open my office, this is why I also take cash and I do not like insurance use for labs. I had a gentleman, I ordered a testosterone lab on him to, just to check it because I started doing that before I left. And I was kind of getting into it a little bit more. And he came back and said, yeah, my insurance charged me $700 for that test. Just,
hit
just a straight total testosterone lab. That was it.
charged him?
Yeah. $700.
How the fuck is that?
Because he had a deductible and they were like, well, this lab test is just going to come out of your deductible. So we're just going to make you pay. And he's like, well, I paid it because I need to hit my deductible anyway. But I'm just like, it's a $20 test. You paid $700 for a $20 test.
Boy,
I'm like,
what a fucking, I hate.
and I'm just like, and so that's why I don't like I have lab services and I have it, but I control those costs. I don't
Yeah,
make any money on labs at all.
right.
Like the fees that I charge, labs are included in that, but it's literally like any lab. So if somebody's like, hey, can we check my thyroid? I check it. It costs me some money, but like I don't make you pay more for me to check it. I
Right.
just include it into those fees,
Yeah.
you know.
Yeah.
Um,
Jesus
but I
Christ.
do that to control costs because I don't know if I didn't. And I said, hey, have your insurance cover it. Next thing you know, you're paying $800 for me to just do a lab panel that I do on my thing that doesn't cost anywhere near that.
Yeah. Yeah, I can
So
imagine that if insurance if you had TRT through there, that like blood work probably wouldn't be every 3 months, because
um,
it's
usually the care is less. It's a lot more hands off. It's about once every 6 months you'd get a visit.
right. See?
So, and that's only because you can't prescribe the testosterone longer than 6 months.
Oh, so that's why okay.
So then they'd have to come
Mm,
back to get a new prescription renewal. So
right.
you could
See?
order a month at a time with 5 refills, and then they'd have to come back in 6 months with labs. If they got rid of that, I guarantee you'd only be seen once a year. You have no idea what's going on.
Once a year?
Oh yeah,
Fuck.
yeah.
Damn.
Who the fuck knows what's going on with your blood work or if it's good or bad or
Yeah.
whatever? Nobody knows.
Yeah, I mean, fuck it, dude. It's the truth. Like, you just got to pay out of pocket,
You just got to pay out of
bite the
pocket.
bullet and
If you
fucking,
want good care, it's going to cost
yeah.
money,
Yeah.
unfortunately. And that's just the reality of it. So obviously we talked about, lab services, imaging services. I want to highlight on one more thing. We can wrap it up here, but um, this actually came across one of my feeds recently and I screenshot it because I knew this data, but it kind of got like backburnered for a while. This actually came out a while ago. Okay. And it goes back to 1970 and it's growth in, I want to say the American College of Physicians posted this. initially. Um, and the data comes from the Bureau of Labor and Statistics, I believe.
Mm-hmm.
It does. Yeah, it says it here at the bottom of this chart. Shorts Bureau of Labor and Statistics, NCHS, and then there was a Himmelstein-Woolander analysis of CPS. Okay. The growth of physicians and administrators from 1970 to 2009. Do you know what the rate of physician growth was from 1970 to 2009? What was the percentage of physicians that increased? Like if we had 10 physicians in 1970, how many physicians would we have in 2009?
Mm. Is it going up or is it going down?
It's gone down, or I'm sorry, it's gone up,
It
but how
has?
much, right?
Yeah. Well, you would think it would go up a lot. There's a lot more
It went up between 100 and 200% over a 40-year period.
over
Okay.
40 years.
It only went up. I don't have the exact
Yeah.
percentage, but it by this graph, it looks to be between 1 and 200%. I
Mm.
believe I think it was 168%. Do not quote me. But I want to say that's what it was. Okay. By comparison, since 1970, what is the percentage of healthcare administrators
That's
what's the percentage it's increased over the 40-year period? Do you want to take a guess?
like
What
at the
percentage?
percentage.
Yeah.
So what was it, 1 to 200? That's probably like 1,000%.
Try 3,200%.
Yeah, I was gonna say it's got to be.
Over 3,000%
Yes,
increase
I
in
figured that.
healthcare administrators
Right.
from 1970 to 2009. And it's only going up. We don't have
Sure.
any more recent data. It's probably even worse than that.
Yeah.
So for every doctor that you see, there's probably two healthcare administrators that
Yes.
get paid money to do bullshit stuff.
To bill insurance companies and make sure that every little thing is being. Yeah, you know what? That's what I was going to ask you. Did you have, when you were filling out those reports, does the hospital like oversee that to make sure that you're billing as much as possible?
Yes, they do.
Fuck.
So they have a billing
There's
department,
an
and
overlord.
thankfully, I have some insight into that too, because my mom is she is the director of revenue cycle management for a physical therapy group
No
that
shit.
owns like 800 plus physical therapy groups.
Holy smokes.
Yeah, so that's what
Yes.
she's done. She's always worked in hospital, like billing and finance, not finance, but like more of the billing side, but
So,
kind of the line in between.
do you have to like hand in paperwork and then it's like reviewed?
No,
Is
so
that
they
how that works?
electronically audit your charts. And here's the thing: if you're undercoding, they will disciplinary action you and say you need to start like you need to do this because you coded too little. Now here's the thing: they don't audit every single chart. They pull like 5 charts,
Uh,
and then you get a percentage. And if you're not like if you got 3 out of 5, you might just have to do like one thing. If you got 4 out of 5, you're good. If it's anything less than that, you're going to like remediation, and they'll make you go to a class in order to learn how to code better. Bitch, I'm not a coder.
right.
I'm a
Fuck.
clinician. Like
Yeah.
I fix
That's
prostates and get
fraud right
people to
there.
pee. Yeah,
That's teaching
it's
people fraud.
ridiculous. Like I didn't go to NP school to learn how to medically bill. That's
Right.
bullshit. So
Right.
I would always advocate to just like the nice thing is when I was in the hospital, I would round there, because inpatient billing is way different than outpatient billing. I don't understand inpatient billing at all. Thank God, because they had a thing. I'd have to bill for like my notes, and down there they could put like chart review or whatever. I'll just fucking click that every single time, and that means that somebody that worked for the company would have to review it and then assign a billing. I just never did it because I was like, I don't know what this is. I'm going to do it
Yeah.
wrong, and you're going to come yell at me and say that I did it wrong because I don't know the fuck what's right.
Yeah, exactly.
So I
Yeah.
just said, screw it. I just, every time I was like, chart review, chart review, chart review, chart review, like every, 8, 9, 10 notes a day, chart review, chart, because I don't know,
Yeah.
and if I do it right, cool. You're not going to tell me that I did it right, but you'll tell me if I did it wrong,
Well, of course. You get
you
fucking
know?
scolded.
Yeah. And I
Yeah.
don't have the time for that, we're busy. So
Boy, oh boy.
Dude, it's a mess. So
Yep.
I hope the takeaway, I hope people found this to be an entertaining podcast. Hopefully we get some feedback on episodes like this. This is sort of like TRT adjacent.
Hmm.
But I wanted to just shed light because I know that comes up, that topic comes up a lot.
Yes.
Why does it cost money? Why do I got to pay? And
Hmm.
now hopefully you have some more insight as to not just the paying structure, but even some of the motives behind the
Sure.
treatment and everything, just from the healthcare side, because that's what they're
Well,
thinking too.
even there are many guys that insurance does cover that
Hmm.
now they can see like, hey, you know what I mean, and maybe ask some questions themselves so that
Right?
they're more aware
Yeah.
because these fuckers will pull the rug out from underneath you, man, in any second, you
Any
know?
second. That's all it takes. So it's
Fuck.
it's a challenge. And I'm not saying that there aren't successful, people that are doing probably pretty good with TRT
Hmm.
through medicine,
Sure.
with through insurance. It definitely happens. I would say it's not a high percentage,
Hmm.
but it can happen and that it exists. But the vast majority, no, it will not happen. And
Yeah.
I would just look to hopefully find a competent clinic that, you know, um, knows what they're doing and you feel
Yeah.
that the value is worth what you're paying.
Yeah.
So
Yeah. That's it. I mean, um, that's the most important part. And that's the most essential part is finding the quality provider and
yeah,
then deal with it, the rest of it from there.
I will say this too. Like if you're a hypogonadal guy, right? Think about how you were pre-TRT, right?
Hmm.
Probably a little bit more cautious, right? Now
Hmm.
you know how you feel on TRT. If somebody was like, "Hey, do you feel like the money you spend on that is worth it?" Or like, would you rather save your money and not have TRT, or spend that money and have TRT? What would your
Hmm.
answer be?
I would spend that money, no questions at all.
Do you think your decision would be different because now you know what it feels like to actually feel good, versus like not feeling good? Because I feel like that ends up being a conundrum because it's kind of funny. I see this as being the person that manages all this. We'll see like how people act when they first go on it. And then like 6 months later, they're like completely different. They're like, no way, dude.
Yeah,
Never.
never going back.
It's like a switch that flips.
Yeah,
And now all of a sudden they're more assertive about like their decision making,
yeah.
and now they're like, yeah, 100% worth it.
Well,
Like, I,
I get the people that write to me all the time or comment say they say things like, "Well, can I come off or can I stop?" And then I'll say, oh, and then you see the other comments too. People say, "Yes, but you're not going to want to."
no, you're not
Right?
going to
Like
want
that's
to. Why?
and that's what I
Why?
write.
Why would you? Why
You
would you? Why
can,
would you ruin a good
but you're
thing?
not going to want to. Like,
Right.
and I don't
And it's
know, 40 yeyears from now, but I'm saying, in the
right.
foreseeable future, you're not going to want to.
Well, it's funny because they just don't know how, like they're you just feel completely different.
Right.
And that's the thing. I think it's different because people also think that I think they go in with like this illusion that it's going to be like a lightning bolt coming out of the sky, and you're going to be
Yes.
like, "Whoa!" And it doesn't work like that. It is
Right.
not like that at all.
Yeah.
But there is a very noticeable difference in how
Yeah.
you feel just on a daily
Yeah.
basis. It's wild.
I think a lot of people are skeptical just because, I mean, there's a lot of, I mean, you see, like TikTok especially,
Oh
there's
yeah,
a lot of fucking, drifters and
oh
swindlers and all,
Charlatan Central.
charlatans and fucking wizards on there that are telling you
Oh
all this
dude,
stuff that,
bunch of bullshit.
yeah, it's all horseshit.
We're gonna
Speaking of
fix your
horseshit,
hormones.
let's real quick get into something we talked about earlier, which would be chiropractors fucking uh,
Dude,
giving
we need a
people.
whole episode
Yeah, you know
dedicated to
what?
them. We
Let's
do that
just
next
save
week.
that. We're gonna save that. Yeah.
I
So
got I got some ammo in the cannon for that one.
yes, because that's been popping up, and I keep sending them to you because I think
Oh
it's
my god.
hilarious.
Fucking don't even get me started on
Yeah.
like
So we'll
the
save that for next week. But if you do reach out to a chiropractor about hormones, or one reaches out to you, uh,
run.
politely, yes, just decline their call or their message and
Tell them you listen to the
move on.
TRT podcasts and that
Yeah.
they're all charlatans.
Yes. So you want your back adjusted
Yeah.
and your neck cracked, but other than
I always
that,
found it interesting that they have a bed that like cracks too.
yeah, yeah.
Did you ever
Like you
see that?
smash that down and then it like,
Yeah, and they have to
yes.
like reset it, and then like they push on you, and it
Yeah,
and they do it to make a noise.
I know.
I feel like that's what it's there
I
for.
never understood that either because my wife walks on my back. I get her to
Yeah,
walk on my back, like when I like because they'll have like days where I just if I combine back, like if I work out back, and then the next day or something I'm doing something, it'll just be like I need like a massage, so I just have her
yeah,
walk on my back, and then she only weighs 109 pounds now, so now I have to have her carry one of the kids and do it, but I never understood because I lay on a solid floor.
yeah,
And then she walked, and it'll be like pop, 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 But
yeah.
I never understood why they did that, and the
They
thing
have
moved
that
underneath
table.
of it.
Yeah, it's to me, it's I feel like it's sort of a scammy, gimmicky thing to like,
Yeah, that is a weird thing.
like they push it and they're like, oh, it clicked. We cracked it. We're good. Yeah, and it's just like, did you fucking do anything? But the table bent
Right.
and made a noise. Like, I don't know.
I have
Uh,
a woman who's a really good chiropractor. Like, I mean, she does this thing with my neck. I haven't gone to, actually should go back to her because she'll do that thing where like whatever it is, I have tension like on the side, like where my traps
sure.
are. And I can never like stretch it enough to where it feels great. But she does this like thing where I swear she feels like she's snapping my neck. She'll like roll her hands like kind of like weird. It's like rolls my head like this and then bang and like turns it real quick. And whatever that does, man, that relieves all the tension. I mean, just for a short amount of time.
Short period of time, right?
Yeah, but it feels
Yeah, I
amazing.
don't know. I'm not trying to, downplay their specialty, but it does seem a
Yeah, no,
little
their
bit
specialty has
goofy.
is exactly that.
Yeah, yeah. When
It's
when
not
they deviate from that lane, that's when
correct.
it gets to be.
Yeah,
Because you have to
supplementation,
remember too,
hormones.
chiropractors cannot prescribe, nor
Mhm,
can they. I'm actually shocked that they even have the ability to read X-rays and have diagnostic reading capabilities.
mhm,
I was seeing a lot of videos going around TikTok. So, as somebody who can read X-rays and at least of the abdomen, pelvis, chest, and CAT scans and MRIs, because I looked at them very frequently, was very trained, very well trained in those. Um, for the things that I needed to look for. Um, I know what bowel gas looks like on an X-ray because I ordered KUB, kidney urinary bladder X-ray for kidney stones all the time, and stones would be obscured by bowel gas all the time.
mhm.
So very easily. But then they're saying that it's inflammation, and it's not, and it's bowel gas. And that was
Ah,
making rounds through TikTok where physicians were like calling it out because they're like, "This is bullshit. Like, what are you doing?" And that's another episode. And we'll probably get into that. I think we could do an episode on like charlatans of social media. And I'm not going to just
huh,
call out
that's an
one,
easy
but
one.
yeah, but we should do an episode on that. Like,
Yeah,
you know, um, how to determine if a place is legit. I know we talked about like on a clinic specific basis, but now
yeah,
we talk maybe on like a social media basis as well.
yeah. No,
So,
that's actually not a bad idea
because it's
because
just there's so much bullshit out there. How do you know like if this person's saying, if it's your first time and you're like, I'm going to get on this topic, and you search it and it's just some dude rambling about something and like, yeah, I got to manage your estrogen and gotta do this, that, and the
yeah,
other, and now that's what you think because
yeah.
that's the only thing you've been exposed to is the incorrect information.
Well, also the
So
guys that, we'll save this for the thing, but like real quick, the guys that are fucking jacked out of their minds
yeah,
that start telling you about TRT, I'm like, okay,
right,
officially, go fuck yourself. Like,
right,
obviously, you've blasted fucking gear for God knows how many years,
yep,
and now you're going to tell me how to do get fucked. Like, that
yeah,
immediately, I just saw a guy the other day that just fucking abs just, there's a difference between, and I think some guys can tell, there's a difference between being ripped and when your abs are just fucking bulging out.
yeah,
Okay. Like when your abs are bulging out, that's not TRT, Holmes.
yeah,
That's fucking gear. I don't care what
yeah.
anyone says. Oh, I've been working out. No, get fucked. That's gear. Okay. So
TRT
when,
looks like me. You know what I
correct.
mean? And
TRT
I'm
is like
I'm
you
a
can be,
pretty
yeah, you can be in
buff
shape
dude,
and you
but
can have like the abs and all that. But there's a look where those abs look like there's fucking hot dog rolls in that bitch. Like that's not
hot
fucking
dog
TRT,
rolls.
Holmes. That's fucking gear. Don't tell me that it is. People are like, oh, I'm natty. I'm this. Get fucked. And
Yeah,
it's like,
Liver King.
right,
Yeah,
exactly. Liver King's
all
a prime
natural. I just eat
example.
liver. That's it. I
Yeah,
swear.
and
That's all I
bone
do.
marrow.
Yeah,
Just shut
has
the fuck up.
yeah, and trend bologna. That's what I
Yeah,
eat.
yeah. Well, I forgot to tell you about the trend. You know, these fucking people. All right. Well, yeah. Let's wrap it up, Josh. So when cash is king, as always. That's what I like
As
to say.
always.
So you can control what can be done. You can control yes, no, maybe, either way. But it's
Yep.
the whole point of it is that you can control it.
Yep.
So the insurance
And
part, although you think it's probably better because you're not paying as much, you're paying probably obviously in service,
yep.
probably in quality
Yep.
and overall well-being, you're
Yeah.
losing. So,
You're losing out.
you know,
Yep.
it's you get what you pay for in life, unfortunately.
Yeah, unfortunately.
Yeah.
So, but
So, with
good
that being
takeaway.
said, next week, the chiropractors, we're coming for your motherfucking ass.
Yeah.
Yeah. But not the one I go to. I like her. Dr. Nikki's
just
the shit.
the loony bin ones.
Yeah, everyone else can get fucked. Dr. Nikki. And she doesn't sell anything. She just will crack my neck and fucking sandwich my, she bends me like a fucking pretzel and then just jumps down on it. And
Nice.
it's like, I'm like, oh my God. That's great. She's good.
It's
But
good.
maybe I should have her on and talk to her.
You should.
It'd be good. She's a foul mouth person too.
That's perfect. She'd fit right in.
Yeah, no, she's a very straight shooter.
Love it.
So, yeah. So, all right, Josh, next week and the
Sounds
chiropractors,
good.
you're on the schedule.
Let's
Fuckers.
do it.
Later.
See ya.